This is just some artificial sweeteners here on the left that should be avoided. Many people, if you go to a restaurant, you might be familiar with these little sugar packets that are on the table as options for sweeteners. I'm going to say stay very clear of them. And once in a while, they'll have a little bit of raw sugar or they'll have some honey. So try to use these options here on the right: honey and maple syrup, monk fruit, stevia. But of course, try to use these still in small quantity, right? Because we still do not want to spike our blood sugar, as in when individuals, because we have cane sugar, right? And if you have ever eaten a piece of sugar cane, when you eat a piece of sugar cane, it's a very difficult piece of item to chew, right? And so you're really getting in a small quantity of sugar in your body. But there are individuals that are extracting these sugar canes and putting them in bottles for people to drink. And that is way too much overtaxing on our pancreas, right? And so we want to be just conscious that we should not be consumed. Just because something is healthy, we still have to be temperate in it, because too much of something can be a curse to us, right? I'm going to show just a quick video here on artificial sweetener.
Sucralose is an artificial sweetener, and there are some pretty big problems with sucralose. And there are studies in animals and humans suggesting that when you consume artificial sweeteners like sucralose or aspartame or ACE-K with carbohydrates, it interferes with your body's normal insulin signaling. It's not terribly surprising to suggest that when you consume something that your body perceives as sweet but actually has no calories associated, it would confuse your body at a neurological and metabolic level. Because historically, evolutionarily, humans have always consumed things that were sweet with calories. So honey has calories, a strawberry has calories, a raspberry has calories, a sweet potato, anything you're eating has calories. So these artificial sweeteners are potentially neurometabolically confusing for the body, and we know that they change the gut flora, potentially in a negative way. So again, we really have to ask the question, what is that doing to humans long term? Sucralose is an artificial...
That is the big question. What is that doing to us over time? And so these are some of the side effects that comes from these artificial sweeteners. So if you've ever consumed any of these and you are experiencing any of these symptoms, see if you've ever experienced any of these symptoms, or the next time you consume them, observe whether or not you even have these issues. Are you struggling with migraines, right? I have a lot of individuals that have headache issues. You want to be conscious. They have a lot of skin issues. So, just pay attention to what you are consuming.